As well, there was another recent report that came out that said the Aboriginal communities are suffering, and many of the children do not even have teeth because dental isn't covered under the Canadian health system. So, they can afford the basic Canadian health care that the government gives them, but anything extra on top of that, they really don't have. And we see that the free service that's offered in Canada is really a facade, because it's not necessarily free if you don't have every single type of coverage, which most people can't afford. That's why 65% of people are paying a bit of an extra cost. So what we have to do in Canada now is pay an arbitrary, unknown number in taxes. The government doesn't tell us how much of our money is going to healthcare costs. We have no idea. Then more money on top of that, and in the end, receive average care. On to the third point, about the value of choice. We think when it comes to a person's health, the government should allow them to make their own medical decisions, like they do with every part of their body. They have the right to refuse certain treatments and surgeries. We think healthcare is obviously a part of that, and we think it's unfair to force people to pay a part of their salary into, I'm going to keep going, pay a part of their salary into a service they might not necessarily be using. I can't really read my notes. Okay, an example of this would be my father. He hasn't been to a hospital in 15 years and might go to a doctor's office every 2 years. He has to pay thousands of dollars in taxes every single year when he's not using the service. We think this isn't how society works. If you eat more, you pay more for food. If you use your car more, you pay more for fuel. Yet if you overuse the Canadian healthcare system, there's no cost and there's no reward for conservation. As well, we think people on the whole can make a pretty responsible decision about their health. If they're young and healthy, they might want a new car instead of health insurance. And in fact, there are 10 million Americans who do not have health care but can actually afford it and choose not to because they rather use this capital and invest somewhere. They rather make more money elsewhere in their lives, and they simply have a choice whether they can spend it or not. And we think that's very important. In the same way that house insurance is a choice, so should medical insurance. We're not forced to take house insurance in Canada, and we think medical should be the same. If people feel that there's a risk to their health or their house, they take insurance, but we really don't think it's necessary to force them to do so. It's also important to note that the United States is a user-pay system that makes it more expensive for smokers, drinkers, and those who live unhealthy lifestyles, and rewards good living and a healthy lifestyle with cheaper premiums. Otherwise, people with no problems have to fund those with unhealthy lifestyles. For example, if Diane smokes all the time, Lewis shouldn't have to pay for her lung transplant. Like we simply think on the whole that if one person does something bad, they should be the one to take responsibility for their actions, not someone else who had nothing to do with them, who certainly wasn't partaking in their bad actions. So we really think if you use something more, you should pay for it more. On the whole, we really feel that it's important to let people decide how much medical care they require, not governments. I shouldn't have to give $100,000 away in my lifetime to the government if I'm using $10,000 worth of service. This would never happen. If we want to talk about equality, we think that's the real equality, letting everyone choose, make their own decisions about how much they need, instead of no one having any control over their healthcare whatsoever. We think people know best. Power to the people. Thank you very much.
I thank the member for his remarks. We shall now hear from the first speaker of side opposition.
Greetings to the members of the House. I'd like to welcome you to side opposition's side of the case, in which we would definitely rather get sick in Canada than in the United States. I'm going to talk about the quality of the two systems in my refutation, but what my constructed material is going to be about, Mr. Speaker, is about accessibility. I'm going to be talking to you about who has access to the American system and about why that's a problem. My partner Lewis, in his speech, will talk to you about why access is something important. I'm going to be addressing if this access actually exists, as Harris has told you. So basically, I'm going to divide my speech into 3 points. In each of the points is sort of going to be talking about a different group you may fall into in the U.S. who doesn't have access. So my first point is called job loss and job lock. My second point is called Medicaid bashing. And my third point is called the uninsured. All right, so to begin with my constructive. So basically in Canada, as Harris has contested and as I'll get to in my refutation, you more or less have access to healthcare no matter who you are. You pay taxes that you can afford, which are sort of like adjusted to your income level, and then no matter how expensive the disease you get is, it's covered. In America, if you're wealthy, as Harris has told you, you get good quality healthcare. We concede that. What Harris has failed to mention, Mr. Speaker, is that if you are an average citizen, as was defined in the resolution, then you really don't have access to this high quality healthcare, and you fall into one of these 3 categories I'm about to cover. So firstly, I'm not this time. If you're the sort of person who gets insurance through your employer, you fall into a situation called job lock. What this means, Mr. Speaker, is that it's legal to not hire an employee in the U.S. because of health costs. If they are sick with something and their insurance is going to be very expensive, an employer is allowed to say, I don't want to hire you because your health bills will be too expensive. This means if you're in a current job and you get sick, you sort of lose the ability to leave this job because you become undesirable. No one else will hire you. In addition to this, it's also legal to fire someone just because their health bills become too expensive. In the U.S., you're guaranteed, 1 moment please, 12 weeks of disability leave, and after that, you're allowed to be fired if your health bills are too expensive. So what this means, Mr. Speakers, in the U.S., if I am insured through my employer and I get cancer, for example, I'm good for 12 weeks. After that, I will likely be fired because my employer doesn't want to pay my health bills, and no one else will hire me because my health bills will be too expensive, and that's illegal. So in this situation, you're really not covered. Yes?
So why is this any different than Canadian companies doing the exact same thing when they don't want to pay for expensive drug treatments because the drug plan isn't covered by the government? It can be covered by businesses as well.
Because in Canada, I don't believe it's legal to fire someone based on their medical condition. So that's the difference. All right, my second point, Medicaid bashing. So the second category you may fall into is someone who is not insured through their employer but who does qualify for Medicaid. So firstly, in order to qualify for Medicaid at all, you have to be eligible, which is only a small percent of the population. You have to be not just poor, but like very, very poor. So this actually encourages people to like fake bankruptcy or like become more poor in order to qualify for Medicaid, which isn't really healthy. But there's also, in addition, other conditions like, you know, like being poor is not enough. You need to have like a disability or be like pregnant in many cases. Like not many people are actually eligible for Medicaid. And even if you are eligible, it's actually not sort of an all-inclusive care, as Harris has told you. Most doctors will not accept Medicaid because the state pays for your Medicaid. It's a lower fee than someone privately paying the doctor. So you're not going to be able to see a good specialist if you have Medicaid because the specialist will be like, I don't get very much money for you, why should I treat you? Yes?
Yeah, but they can still go to county hospitals as opposed to the Aboriginals, the poorest people in Canada who still receive terrible medical treatment.
Okay, Aboriginals have the option to go to hospitals if they don't want to. That's their choice. In the U.S., no one has the choice to see these high-quality specialists if they want to. My point is, Mr. Speaker, yes, you could go to like a low-quality hospital, but the high-quality care that Harris has been telling you about only applies to a very small percentage of the population. Okay, on to my third point, the uninsured. So this is sort of like the bulk of what we're going to be talking to you about on side opposition. If your employer doesn't provide insurance or you're not poor enough to qualify for Medicaid, then you have to purchase insurance on your own. If you're healthy, that's fine. But if you're poor, but not poor enough to qualify for Medicaid, then you just don't get insurance at all. If you have a pre-existing condition, like if you have a heart condition or cancer or something that's not your fault, Harris gave you the example earlier in his speech, like if I smoke, then it's my fault, I'm sick. But we know, obviously, Mr. Speaker, that in most cases, sickness is not self-induced. You have a genetic condition, you have MS, right? In this situation, your health care is going to be exponentially more expensive because the way insurance works in the U.S. is the insurance company sort of takes a gamble on you. I think I'll be able to make more money off you than you're going to cost me. And if you have an existing condition that's not the case, it'll either be unavailable to you entirely or be very expensive. Yes?
But how is that different, Diane, from in Canada where pre-existing conditions aren't covered by Medicare?
Pre-existing conditions are, everyone's covered in Canada. I don't entirely understand the POI, sorry. And it's not like people in the U.S. who don't have health care insurance don't want it, and it's not like they don't work. Nearly half the people who are uninsured in the U.S., which is 45 million, by the way, worked and had a salary of $50,000 or more in the year the stat was taken. So like these are hardworking people who just still can't afford it, so it's clearly too expensive. Right, so basically what I've told you, Mr. Speaker, oh, by the way, 40% in the U.S. have inadequate insurance. Just thought I'd throw that stat out there. So basically, what this causes, Mr. Speaker, is a false sense of security. Because you have insurance through your employer, you think maybe you'll qualify for Medicaid, then something serious happens, then suddenly you're fired, you realize you can't afford it, your insurance prices go up. So basically, there may be this good quality healthcare that exists for